I stand in front of you today, not as an alarmist, but as a scientist. A scientist that understands that climate change is driving us to a point where we are at a pivotal decision-making position for our society. As I say, they had the first malaria outbreak in Florida. This was not something that the US has seen before in its history. What more? Our coastal cities like Mombasa are expecting to find significant challenges due to rising sea levels. This brings its own challenges, and from a disease perspective will mean that we have more cholera outbreaks than ever before. And of course, the thing that scares me the most is to do with the fact that there is habitat destruction going on as a result of climate change. Animals and insects are living closer to humans now than ever before. SARS-CoV-2 was first a disease in bats. The disease that caused the COVID-19 pandemic started in bats and then moved into humans. Ladies and gentlemen, I'm stood here in front of you today telling you that if we don't stop climate change, the next global pandemic is closer than we think. So let's discuss the COVID-19 pandemic. This was a time of great sadness and difficulty for so many people. So many people lost their jobs, lost their businesses, and sadly, so many of our close loved ones lost their lives. I was stood as a scientist at the front line, trying to create new ways to test for this condition. And what we found was this was challenging, individually testing each member of our community. I also found myself losing loved ones to this horrible pandemic, and this brought immeasurable sadness to my family. But what I saw was that we don't have an effective way of monitoring health that is damaged by climate change, the impacts of climate change on health. Now, I would like you to pause for a moment and just think. Think of what is one thing that we have in our lives that is touching every type of life on this planet. One moment to think. Water. Water is something that embodies all of living life. It flows through us, it flows through our communities, it flows across the environment. I believe that we could use water to help monitor the impacts of climate change on health. Not just human health, but the health of animals, environments, and humans alike. To help you understand how we can do this, I want to bring you along a journey. I'm going to tell you 3 very short stories. Okay? 3 stories. One from our past, one from our present, and one which I hope we can develop together for our future. Our first story starts in 19th century London. Now, this sounds like something miles away and at a distant time, but actually it's not so different to how the Kenyan cities are developing today. It was a time of rapid innovation, industrialization, and population growth. It was a time that we were seeing big changes in London. It was a time, though, of challenges to infrastructure. Our infrastructure could not meet the demands of the population. This is not so different to many Kenyan cities today. Nairobi, Kisumu, Mombasa, all are having challenges where the infrastructure cannot meet the population demands. And at that time, what came was air pollution, water pollution, and disease outbreaks. These disease outbreaks meant that we had cholera epidemics across London. Why? Because people were dumping their waste into places they shouldn't, into the street. London smelt terrible. Terrible. It was the time which was termed the Big Stink. And as a result of this, we saw that people fell unwell in communities. Then stepped in the main character of our story, Dr. John Snow, a scientist, but a doctor at the time, who thought of something different. He suggested we map the locations where people fall unwell in London. He wanted to understand how the disease spread. At the time, people thought they were just falling unwell because of bad air. But it was because of water, contaminated drinking water, that they identified the solution. John Snow identified a single water pump at the heart of London, and by removing the handle overnight, he saved thousands of lives. Dr. Snow discovered two things that day. One, that contaminated drinking water causes cholera. But something more important, tracking the spread of disease using simple techniques can help save lives. And we use this technique today and to save millions of lives every single year. This was the discovery of epidemiology. This brings us into our present day, our second story. In our present day, epidemiology is practiced around the world. Now, we've discussed how COVID-19 was a time of hardship and grief and difficulty for so many people, but it was also a time of fantastic innovation. When countries and organizations needed to understand how COVID spread in society, they turned to a new source of information: wastewater. Wastewater-based epidemiology, the process of using our sewage, our waste, to help us track the spread of disease in society. The process? Very simple. We go to places where sewage is found in society, where many people's sewage collects, whether this is a sewage treatment plant in a big city, or a septic tank outside an apartment block, or whether it's a wetland in a rural community. Any of these locations will contain human waste. We can sample it, we can take it to a lab, and these labs are nothing different to what you would have in hospitals and labs across Kenya right now today. You take the samples there and you can quantify, you can measure the level of COVID in that population you have just sampled. When replicated, when done over and over again across the Kenya, across the country, over time, you can measure the levels of COVID as they fluctuate in the population. Now, as we move beyond the pandemic, as we move beyond COVID-19, there are different challenges facing our society, climate change being the biggest one. We now know that we can use wastewater-based epidemiology, this process that was developed for COVID, to measure far more. We can measure human health using wastewater. Things like different biomarkers, like obesity, heart disease, drug use, and diet. We can measure things associated with animal health, like zoonotic diseases, these diseases like COVID, before they become a problem, as an early warning system for our planet. And we can use measurements in water, just your river water or any other water source, to monitor environmental health. When put together, this forms the idea of one health. Because we have one planet, we have one health. The health of our humankind is dependent on the health of animals and the environment. Now, I said I was going to propose a vision for the future. This is something that I hope most of you could share in with me today. I mentioned water is a fantastic source of information, but there are many, many more. This is the digital age. We all have a smartphone. We all have a wearable piece of technology. We all have some sort of data source on our body right now. We also have Google Earth, a way of monitoring the planet, monitoring migration. We have satellite imagery. We have so many data sources we don't know what to do with. If we want to solve the climate crisis, we need to be able to measure things more effectively. We need to bring these data sources together, integrate with water at the heart. By doing so, we can monitor climate change, the impacts of climate change, but more importantly, the interventions we make, all these fantastic things we discuss about changing and implementing, we can see change in real time. Not just global temperature data, but the data we get from water. I started my talk in probably a very depressing way by telling you that our planet is on the brink of devastation. I hope that I provided you somewhat of a solution, not a solution to climate change, but a solution to how we monitor for it, how we monitor the impacts on our health, how we monitor the impacts on our society. In 19th century London, Dr. John Snow first discovered that contaminated drinking water was the problem. Ladies and gentlemen, today, I stand in front of you today saying that the future is water, and water is our solution. Thank you very much.